There is a wide world of resources available for somebody who is seeking treatment for addiction or alcoholism. How do you know where to begin? How do you know what is the best option for you? Very often people are pulled in different ways in terms of what they're supposed to be doing for recovery. On this episode today, I break down for you something that I call the recovery layout. And the recovery layout is looking at what is the available evidence-based approaches in a systematic way that you can use to recover. And I'm very practical. I think anybody should be using avenues that they like, they find interesting, and they find useful and are in line with their values. And we're going to talk all about that today on this episode. Let's delve into it. So the recovery layout is something that I designed to diagram and make sense of what can be very complex and overwhelming in terms of how to begin with addiction treatment, what's available to you, what you might want to use. There are plenty of options for anybody to recover. I think it is important, you're going to have to use some options. And this speaks to areas of motivation. I have had patients over the years who, for whatever reason, cannot find any option that would work for them. And then I would raise the question of where they're at in terms of stage of change. Are they really done with drinking, or are they really done with their substance use? I do believe that these options are so distinct and so different that you should be able to find something that you're like, I can get behind this. Oftentimes people do have these roadblocks to different avenues: cost, access, availability, the time commitments in their life. All of that is okay, but let's still find something that would be meaningful and useful for you. So these are our three overall columns for what we have in terms of recovery specialized treatment. We have what is very often my territory with patients, which I call psych or MAT, and we'll talk about that a little bit. MAT stands for medication assisted treatment. And then we have the different options for therapy or more kind of classical treatment. And then we have peer support. And peer support is very often more unstructured, and it's going to involve people in recovery helping to give back and to, in an altruistic way, towards other people to make a difference for change. In the territory of psych, we use a dual diagnosis approach for anybody who's struggling with alcoholism or addiction. And this is the interplay between mental health and addiction, and seeing them as more synergistic and blended rather than very distinct. I think it's also important to know that we need to have a plan that does address both of these instead of an either or a chicken or the egg phenomenon. I have had patients over the years who will be very on board with addressing their depression, but they will not be on board with addressing their drinking. And for different reasons, they might feel ashamed, or they might feel that it's stigmatizing or something. Those people very often don't get a great result. We need to address both parts of this schematic. A strong emphasis on these approaches of looking at safety, especially when we're talking about medications. It can be very hurtful if I put you on a medication that can lead to further addiction or can cause other problems. So we like to emphasize safety above all in the realm of dedicated addiction treatment. So MAT is very powerful for certain conditions, and MAT involves using certain medications. Very often we call FDA approved, but sometimes there's something called off-label. Off-label means a medication approach that we've found through clinical studies as useful for a condition, but perhaps this might be a generic pill and there's no money backing this, so it doesn't get the FDA label, but it still might have good use. When we're really talking about this, we're trying to prevent relapse. So this sometimes has to do with reducing cravings to use substances, stifling the substance use or blocking out, or helping with anxiety or symptom management. What are some examples of MAT approaches? The medication buprenorphine, or one of the brand names is called Suboxone, is an FDA-approved med for opioid addiction. Naltrexone, the medication Chantix, is used, is FDA approved for helping people quit smoking or nicotine addiction. And then medications like methadone, which are replacement therapy approaches, once again for heroin use. When we talk about different forms of therapy, I think it's important to know that there is a hierarchy or a scaffolding for this in dedicated addiction care, and we use this as we call the levels of care approach. This was designed in the early 90s by a program called the American Society of Addiction Medicine, and they wanted to put treatment in a four-part approach. Outpatient care, which is kind of the lowest, least intense care. A high-intensity outpatient program called intensive outpatient. That's usually a group therapy approach that will go for 3 months. Level 3 care, which is sober living, where people will oftentimes be not staying back at home. They might be living in a halfway house or another alternative for maybe a couple months to offer them some greater accountability and structure for their sobriety. And then the highest intensity treatment is residential care. So that's like very often classically called rehab. And then finally, we've got avenues of peer support. So we think of some of the heavy hitters for peer support. This is AA, NA. These programs have been around for approaching 100 years. They involve one person who has made strides in recovering and changing from alcoholism, and then an altruistic approach where that person is helping out somebody else. And they use a concept of, to be able to keep it, you need to give it away. And so service and altruism is very important in these programs. Technically, those are called peer support or a 12-step program in which they will have a series of steps that somebody might walk through. It's important to know that there are other examples of peer support as well, and a lot of people don't know as much about them as they do about things like AA. So examples of these is a program called Smart Recovery, which has a strong emphasis on understanding thinking patterns, understanding cravings, and coping skills. So it draws from a little bit of a form of therapy called cognitive behavioral therapy, or CBT. We have other programs as well. There's a more of a faith-driven program that's called Celebrate Recovery. That's very often through Christian churches. We also have a program that's called Recovery Dharma. That is more of a Buddhist theme. And then there's also LDS Recovery as well. And each of these is designed by different institutions, but they're all fundamentally sound, and they really do emphasize empathy, chronic disease approach. They all can add a lot of value. So once again, this is our overall framework in terms of what we have if you're looking to recover. We can look at psych options and making sure your psychiatric treatment is good, safe, and efficacious. We can use medication approaches to help to prevent drug use or relapse. We can look at the scaffolding of treatment and different avenues for therapy and the levels of care approach designed by the American Society of Addiction Medicine. And then we've got peer support avenues. And it's important to know that there's a few different peer supports that are available. You can work with one of these columns. You can work with all of these columns. You're going to need to do something that you feel speaks to you and can be useful. So we're trying to understand this as a flexible approach, an evidence-based approach, and also a very practical approach to meet your needs so that you can really recover from your primary struggle. I hope you find the concept of the recovery layout helpful to you. I developed this myself. I use it with my patients, and it is very practical to kind of set the stage and get the ball rolling in terms of what speaks to you and what column you want to go down if you're interested in recovering and changing your life. We can't do nothing. So I think it's important to know that if you do nothing, ultimately your addiction is going to catch up with you. You're going to find yourself relapsing time and time again. So it's important to know that you are going to have to own it, and you're going to have to use something that can be meaningful. But it isn't just a one-size-fits-all concept. We have flexibility, and we have lots of different options that can be useful for you. Once again, I'm Pat Fehling. I'm happy to help you understand this and to use the exact same skills and teachings that I'm giving to my patients to give to you. If you liked this video, please subscribe to our channel, link us, This is a way of disseminating the message of evidence-based scientific recovery to people that are out there. They might not have access to treatment. And the more we can disseminate, the more people can see that there really is a method to the madness and they really can make some changes if they use their brain, then we use the research, and we put it into action. Thanks, guys.